Hello, I'm Jeffrey Flowers from Woodstock, Illinois. I will be talking about my job as a CT technologist. Let me first give you a little overview on what a CT is. A CT is an imaging procedure that uses special X-ray equipment to create detailed pictures of areas inside the body. It is also called computerized axial tomography, CAT scan. Each picture used during a CT procedure shows the organs, bones, and other tissues in a thin slice of the body. The entire slices of pictures produced in CT is like a loaf of bread. You take that bread, slice by slice by slice, and open it up and look inside each slice of the bread. That's what we're doing to your body with all the organs, like the liver, the kidneys, the pancreas. We're taking those organs and cutting them slice by slice by slice. And then we're opening them up and creating 2D or 3D images of your body. CT can be used for many things to look at, such as cancer in the abdominal area or brain or any other body part in your body. It can be used for looking for blood clots in your heart or extremities, aneurysms in your brain, or as well as your organs, such as kidneys or your liver and disorders of those organs. The average person in the United States receives an estimated dose of about 3 millisieverts of naturally occurring radiation per year from radon and other sources from the outer space. Now, whenever people hear CT scan, they start freaking out about radiation, thinking, oh my God, it's going to cause cancer. I'm going to get sick from it. That's not really true. CT does not cause a lot of radiation. In fact, a CT scan of the chest is about 3 millisieverts, which is about a half a year of radiation that you can get from outside sources. Just like I said, 3 millisieverts is a chest. That's not a lot. Now, if you get a CT scan every week for the next 6 months, then your radiation starts adding up and you can start getting risks like skin cancer. Let me show you a little picture here of a CT scanner and some anatomy to help you understand what CT is. We can just come in here a little bit. I have one can there. Okay, so here's the CT scanner. It's like a donut-shaped scanner. It's open, whereas like an MRI is closed, which is the nice thing about a CT. It's open so you can see the beginning point and the end point. So most people with claustrophobic issues can get through CT with no problem. Here are your buttons on the CT scanner that the tech is pressing. These control your table positions, up, down, in, and out. And of course, here's the patient on the table. This patient is feet first for an abdominal scan or chest scan. They could be feet first or head first, depending on which type of scan you're scanning for the anatomy. And over here is the CT injector. That has our CT contrast in there. It's our iodine contrast. That goes through your IV site, which we start on you for most scans. The contrast, the iodine, what that does, it enhances all your major vascular organs, your liver, your kidneys. It makes you glow inside, so we get good pictures. We also have you drink our oral contrast too. And what the oral contrast does, it highlights all your intestinal system, which makes your intestines glowing. So when we do the scan, the oral contrast highlights your intestinal system, and the IV contrasts highlight everything up above that, your major organs. We really need both of those contrast agents for a good diagnostic study. And as far as the table, it's pretty much a hard table. We can't really have too much cushion on it because it will show up on the CT scan, which would cause some artifact. And then here's a little anatomy. This is an abdominal scan. I know this is a little confusing to most people. It takes a while to get used to the anatomy. Right here are the kidneys. That's your right kidney. This is your left kidney. Of course, you have two kidneys, as you know. This is your spine. Here's the fat and tissue outside your body. Here is your spleen. And all this up here is your intestinal area. The contrast usually highlights this as like a white. You probably can't see it that well. There's a few white spots like over here, which would be highlighted. The contrast would show up. Over here is your liver, and that is your gallbladder. And then right over here. Here's a picture of a brain. Of course, a normal brain would be like gray matter. These white spots are not good. What these are bleeds in the brain, like strokes. Bleeds, one on each side, one over here and one over here. These bleeds are pretty big, the chance of survival is pretty slim in this case right here. Strokes and bleeds could happen to anyone, anywhere from early as 20 I've seen, as old as 80, 90 years old. It doesn't matter how old you are, really. It can happen to anyone, especially with family history of bleeds. Now let me talk to you about this standpoint from a patient perspective, from beginning to the end point of how we scan the patient. So as an outpatient, what we do is we go out to our front lobby and we call our patient by their last name. And when we get the patient, we ask for 2 identifiers, their date of birth and their last name. That just makes sure that we are getting the right patient. We don't want to get the wrong patient, of course. That would be bad for us. Once we get the patient, we set them in our IV start station. Like I said, most patients need the IV contrast. Now, I was going to go into nursing, but I didn't want to do nursing because I found out we had to do IVs. So when I started CT school, I learned that we had to do IVs as well in CT, so I started freaking out. I'm like, oh my God, I'm not going to be able to do it. To tell you the truth, I got through it. I remember my first IV when I started on a patient. I was shaking so much. It was so embarrassing. The patient was like, are you okay? But after a while, you get used to it. I mean, it just takes practice. And I'm not the greatest person at doing IVs. It takes practice, like I said, but I'm a lot better from day one. So, of course, you start the IV on the patient, and of course, it highlights all your organs, makes them glow inside. I always explain to the patient what the contrast is going to do. It's going to make them warm. Once we give that dye to them, what it does, it goes through your veins and it goes through your whole system in the body, your heart. It gives you like a warm flush feeling. Of course, if you had a CT scan, you would know what I'm talking about. It starts usually by your ears, mouth, throat area, and that warm feeling goes all the way down your bottom like a little hot flash. It makes people feel like they're peeing in their pants. So when I tell a patient, it makes them feel like they're peeing in their pants. They usually remember, oh yeah, I had that contrast before, that warm feeling. It does not hurt at all. It's like a warm hot flash. It lasts for about a minute or two. So I explain that to them. I ask them if they have any questions. If not, I go ahead with the test. And of course, I get a good history from them on why we're doing the test, so our radiologist can read it better and get a good diagnostic study. Once we're all set, I get them on the CT table. And like I said, I either get them feet first or head first, depending on what position we're doing. For chest and abdominal scans, we do it feet first. So I get them in the table, I get them all positioned, I hook up our contrast to their IV side, and our injector automatically injects it at a set rate. So it's not going like at a super fast rate. I get them to the table, I make sure they have no questions, of course, and then I come back to our computer system, our control system, which sets everything up. You got to set up the picture, the scout we call it, of the anatomy, and scan it. And then, of course, once the scan's over with, the results usually take 1 to 2 business days. And then, of course, we explain to the patient to drink plenty of water. That IV contrast we give, it sits in your kidneys, and the water helps filter it out. Now, the IV contrast doesn't really harm you, but for every patient, we do draw labs, blood work to test your kidney function. We want to make sure your kidneys are filtering good. If your kidney levels are not good and not filtering good, what that means is that contrast we inject will be sitting in your kidneys, and it won't really filter, and it can put you in renal failure. So anyone with renal failure or that has bad kidney levels, we usually don't give them the dye. We don't want to put them in any harm. And of course, after the test, we make sure the patient is clear, has no questions, and has a good understanding of what we did today. That is my job description as a CT technologist. I've been doing it for about 3 years now. I love it. In the future, I hopefully would like to be a manager in a hospital or nursing center, a nursing center in the medical imaging department. Once I graduate the program, I know it takes experience, of course, in the medical field, but my goal is to be a manager in the next 5-10 years. Thank you, and I hope you enjoyed this presentation.